Okay, so we are SoulADC, and these are all the barcodes. You can just scan, and you can actually take a picture and join us anywhere, wherever you like. And I'll go ahead now. So I'll start from here again. So your ADC, that is your Australian Dental Council, they do an exam to check how much we are eligible or how much do we focus and provide care and treatment to the patients. So they do it in three steps, that is initial assessment, written examination, practical examination, and then you have 2 months to where you get your registration done. After that, you become a registered dentist in Australia or New Zealand. Now, when I talk about the first step, that is your initial assessment, these are the documents that you require for your initial assessment, and they will also require that you submit your 4 years degree, how much you have scored and all those documents, although they do not judge based on how much you have scored in your dentistry. Now, you can actually apply for the exam when you are in the internship period as well, because their main criteria is that you have completed your 4 years of course. The time frame for which they give you an answer and all those things start is 8 weeks. And if we see the cost is $647 for the application. And when you apply for the initial assessment, from getting your initial assessment till your practical exam, like it is getting over, you can get it renewed. Now, written exam, that's the cost for written exam. And if we talk about your periods of application, it's period 1 and period 2. So it happens twice in a year. Period 1 is this is the time when you apply for the exam, and people just sat on 11th and 12th of March this year. The next one you will be sitting in September, that is 16th and 17th of September, for which you have to apply in your June time. Now, all those who have just joined, thank you so much for joining SoulADC. We have just started on discussing about our ADC steps: initial assessment, written examination, practical examination, and what happens. I've just discussed about what are the documents required and the cost and the initial assessment thing. Now, if we talk about the requirement for your written exam, obviously you have to sit for the exam, and for that you have to apply for the exam. But before that, you complete your initial assessment, and when you go and give your exam, you have to carry your document, that is your passport, which should have your photo definitely, and that's how they will be able to recognize that you are the person sitting for the exam. Now, just remember, whenever you go for the exam, be on time. If you're even 1 minute late, they will not allow you to sit for the exam. And when I talk about the ADC, now ADC looks at a person who is coming there for your part 2, or generally who is sitting in the exam. They want to see you and they want to judge you on different parameters. The most important for them is, are you knowledgeable or not? Do you know everything? Can you manage your patient or not? Do you have the skills of solving the problems or not? So, based on that, they have made domains which are six in number. The first one, if you see, is the social responsibility and professionalism. How responsible you are for the people of Australia and New Zealand. Do you wish to do something for their benefit, or you have certain other benefits for yourself from that? So, social responsibility and professionalism. Communication and leadership. Now, in Australia, they prefer that you talk about everything before starting any assessment or even giving any treatment plan to them. So you ask a lot of questions, you tell them, and that's what the leadership quality is. Uh, After that, the third domain they are talking about is critical thinking. You should be able to understand, oh, I should do this or I should not do that. Health promotion, where, for example, a person is smoking. So it is your responsibility to talk about smoking, that it is injurious for your health, for your gums, for your bone, all those things. Scientific and clinical knowledge, if I talk about, definitely they want to see your knowledge, how much you know or not. Then if I talk about patient care, there are three things inside it. One is your clinical information gathering, your diagnosing and management, and your clinical treatment evaluation. And when I talk about patient care, here are the three things that we need to know. One is your clinical information gathering. What does it include? That includes what is the chief complaint of the patient, the history taking, and when we talk about diagnosing and management, it is important for us to identify what is the situation, what is the health of the patient. For example, if I talk about there is a white lesion inside your gums or on the cheeks, I mean. So you should be able to identify, is it leukoplakia? Is it lichen planus? Is it leukodema? What exactly is it, right? So that comes under diagnosing, and then you have to manage the patient. Now, management not only includes giving medicines, it includes everything, holistically managing the patient. Clinical treatment and evaluation, when we talk about, we are talking about how will you treat the patient. Are you going to give corticosteroid to a patient? Are you going to give metronidazole or any penicillin, that is your antibiotics, or are you going to give any painkiller to the patient? So when we talk about your part 1, they are focusing on your 1, 4 and 6, and we need to work on all these domains so that we can crack the exam. Now, those three parts that I said, 1, 4 and 6, they are put under different clusters, that is 1, 2, 3 and 4. Your first cluster consists of your social responsibility and professionalism. Here we discuss about code of conduct. We discuss about what we should do, your record keeping and all those things, and your health promotion. Then the cluster 2 is your clinical information gathering. Your diagnostic and management planning is your cluster 3, and your cluster 4 is your clinical treatment and evaluation. Now, these all you need to pass to clear the exam, and that's the percentage of the exam format, how these things will be covered in the exam. Now, when I look at these all 4 clusters, I should have a question that what all are going to be covered in the exam. So this is the percentage, how it looks like. So if you see here, your preventative dentistry has one of the highest amount of questions category that we see, or your peds or ortho. So they take up 10% of your exam part, as well as your restorative, which is the highest to be of 14%. Now, the most important thing that we need to read is your pharma, that is your therapeutic guidelines. Now, your therapeutic guidelines will be scattered in all these parts, and there will be a lot of questions that can be there. And when we talk about your radiology can be part of any of these subjects. For example, if we talk about your ortho, you can get a lateral ceph in that. Or we talk about your restorative, there can be a filling x-ray there, and you need to identify which x-ray is that, as in which side is that, or which type of filling is that. Or maybe in perio, when we talk about how much bone loss is there. So anyway, they can put it so that they can check our knowledge. Now, if we look at the questions, how many questions come in the exam? There are 280 questions that we'll see in the exam. And out of these 280 questions, 240 will be marked and 40 will be unmarked for us. And how do ADC decide that these 40 questions should not be marked? It all depends upon, as many people are sitting in the exam, how much people have answered that question. So if question number 1, everyone cleared that question, if they all answered that correct, they will make it as unmarked. I've heard it from a person who did ADC long back, and they knew the secrets about it. So 40 questions which are unmarked are the ones which everyone will answer, and 240 will be the ones where they can find out the cream and they can take it out, who can pass the exam or who they want to fail. So these all 280 questions, they will come under different papers. Now paper 1 and paper 2 will be on one day, that is your first day, and there will be a break of 45 minutes in between. With respect to your paper number 3 and 4, that will happen on the next day, and same 45 minutes gap will be there, and all the papers are 2 hours of length. Then when you give your exam, you come out, you think about your exam, how did it go? After that, your result will come out roughly after 1 month, and you'll get the result as A, B, C, D. Your A and B is pass. It doesn't matter what you get. Do you get A or B? It hardly matters. You just have to pass the exam. C and D are fail. So you have to avoid getting C or D. You have to study good amount then. Now, if you look at the previous year's pattern, if you see, these were the number of people who sat for the exam in 113 venues all around the world. So 33 countries were the ones from where people sat for the exam, out of which, just imagine, only 12% passed. That is 404 people passed the exam and 88% people failed. And now, what could be the reason why they failed? There could be two reasons. One is the quota. The ADC wanted only some amount of people because they want to save the dentists who have passed the exam, or the people who have studied from Australia or New Zealand. So they don't want to get saturation that we see in our country. Or the second reason, it could be that we don't have proper knowledge to clear the exam. Because if you see here, this was 50% when the COVID hit, then 44%, then it dropped to 24, 41 in between, but then 12. So these two reasons can be there why people didn't pass the exam. Now, a lot of people filled the form and did tell me or did ask me to discuss about from where to study, what to study. So these are all the things that we need to work on. This is all provided by your ADC, that these are the things that we need to focus. And the most important is your clown book, or we call it as therapeutic guidelines. Now this is the old picture. I had no new picture of the new TG. The new TG I will provide it to you when you join my course, and we will discuss. I have recorded videos where we'll discuss about all those things. I'll explain you later on about that. So this is the most important book. You start with this book whenever you start, and your infection control. That this is the two books that we prefer in Australia. So if you enter your clinic, you go into your area where you sterilize your instruments. And what do you do first? What should be the second test that should be done? All these are included in your infection control guidelines. And your therapeutic guidelines, they tell about your medicines that is to be given to the patient, when you give what, when you don't give, what is the treatment that you should do, or the whole management. It talks about every sort of thing, which is really important. And trust me, if you know this book by heart, any question comes in the exam, you can correlate and you can try to solve it out as well. Now, these are the type of scenarios that we see in the exam. If you see, on the left side, there will be a question, and on the right side, there will be sub questions under it. So there are 5 sub questions under one particular question. Okay. So now I thought it's good to discuss about one question in between and see how you like it, or are you able to solve it out or not. So I want you to go through this question, and I'll give you 30 seconds to answer this question here, and after that I'll explain you all. So now let's read the scenario first. I'll give you 30 seconds. You try to identify which answer should it be, A, B, or C, or D. And then after that, I'll see how you answered it, and then we'll go ahead with that. So Nancy is 45-year-old female who has tooth pain every now and then and is unhappy with the way her teeth look. Her last visit to a dentist was 6 years ago, at which stage she had no obvious dental disease. Nancy is taking a beta blocker for hypertension started 3 years ago by her general practitioner. Now, this is the question. I want you to go through this question, which says that Nancy tells you that she is keen to regain her oral health so she can eat properly. What is the most likely explanation for her recent deterioration in her dental health? You have 30 seconds. Please try to solve it out and then I'll explain you this question. Your time starts now. I have a small clock with me. I can see a lot of people have answered 4B. It's good that a lot of people said the right answer. So now let's look at the question. So we know she is 45 years of age and she has pain on in her some tooth and she's unhappy with the way it looks like. So whenever you see a question like this, what is my way of doing is I categorize it in a different way. I put it like, what is the chief complaint of the patient? Then I do what is medical history, dental history, social history, family history. Now, whatever is not mentioned here, I'll just cut it down. Social history is basically here. I will ask or I'll see if the question says smoking or alcohol. Medical history, any medicine the patient is taking, or dental history, when was the last patient visited, or any concern apart from the chief complaint, anything else that you see is given in the exam. So what do you see here? The chief complaint will be the patient has pain, tooth pain, and patient is unhappy with the way her teeth looks like. So I'll say aesthetics. Now in medical history, I can see beta blockers. And I can see patient has hypertension. I can see in the dental history, she visited 5 years ago. There's no information about smoking, alcohol. So I'll just cut it out. Okay. And now we need to understand is what exactly is happening, what the patient is saying. The patient is saying that she wants to regain her oral health. And what is the most likely explanation of recent deterioration in her dental health? Recent deterioration. Now we can see there is that she is taking beta blocker. Now what does beta blocker does is it causes dry mouth. Now if you see dry mouth in any patient, what it can lead to is it can cause accumulation of plaque. Now there can be plaque accumulation because there is lack of saliva in our mouth, and when the saliva is less in the mouth, what goes on is it cannot fight against or it cannot protect your mouth against bacteria. When it can't protect you against bacteria, plaque accumulates and that causes dental caries in a patient. Now that is the reason why she is having dental caries. Okay. But what does the patient say? What the question say? What is the most likely explanation for the recent deterioration in her dental health? So the answer will be change in the saliva, because the question does not talk about any fluoridation. It does not talk about your poor quality of restorative treatment because we don't have any history about it. We do not know if she is using hard bristle toothbrush or not. Whatever is mentioned in the question, we just try to solve it out. We do not add our own information about it, that she might not be using proper toothbrush or electric toothbrush, or she's not in a fluoridated area. We don't know about it, so we will not focus on that. Okay, we will only look at whatever information we have in this scenario. Any questions so far? Yes, Rita, you're right. It causes cavities. Amazing. Thank you so much. Okay, now let's go on to the next question. I'll give you 30 seconds again. Let me put the timer. That's your question. Okay, so your left side is exactly same. It has not changed. Your right side has changed. I'm putting the timer on. I want to see what you guys answer and then I'm going to explain it. Your time starts now. Okay. Now, I would like to see what everyone feels like. Have Okay, see. Okay, so I'll just go back and we'll discuss on the question. Everyone, you are amazing. You know the answer. That's amazing. But I'll still explain for those who don't know the answer or who have not started the preparation for ADC. So it says that in addition to pulp sensibility test. Now, what is pulp sensibility test? Pulp sensibility, as the name suggests, sensibility. So it is sensing the tooth. We are sensing if the tooth is alive, is it working there, or is the tooth sleeping. Just use the normal words and let's try to understand in that way. So if this is your tooth, we have pulp inside. Everyone knows that. Okay, so pulp sensibility test, like your hot test, your heat test, your cold test, those are called your thermal tests. Then we have electric pulp testing. These tell us about the sensibility of your tooth, if the tooth is responding to us or not. Now, when we put something cold on the tooth, that is, we are doing dry ice test, that is your cold test. When we did that, the response that we get is either the tooth responds or the tooth will not respond at all. So that will tell us the tooth is alive or dead. Now, in alive, it could be either your irreversible pulpitis or your reversible pulpitis, based on how much time it is taking to respond to it. Okay. Now, once you have checked your pulp sensibility test, you know the tooth is either alive or it is not, or where exactly the issue lies. However, you also need to see if there is an issue happening here or not. And to check that issue, you need to tap on the tooth to see if the tooth is responding to it or not. And that will be your percussion test. That's why we select percussion test here and not your periodontal test or your mobility or transillumination. Your periodontal probing and your mobility test will be for your perio condition. Here we are not talking about perio condition. Here we are talking about there is pain in the tooth. Okay. And transillumination, where will you use? You can use in identifying how the tooth looks like. Can you see the blood supply inside it? That's a new test that nowadays people do. However, it is used for your fluorosis cases, how deep the issue is, how much is the fluorosis inside. So that's why these are vague for us. These does not tell us good information, and we do not need to do a hot water test because we have checked if the tooth is alive or not by your cold test. So we do not need to do your hot water test here. Now go on to the next one. Again, you have 30 seconds to solve this question. The question is, what restorative principle is the most important in ensuring a favorable prognosis for tooth 2-3? Your time starts now. So question number 3 says that what restorative principle is the most important to ensure a favorable prognosis for tooth number 2-3? Now, how do you identify what tooth is 2-3? A lot of people have problem in identifying your 1-3 and 2-3 and where is your third quadrant, fourth quadrant. So what I do is, always when we see a picture in front of us, just divide it into 4 parts. 1, 2, 3, 4. Just write this number. Same with this is your first quadrant, this is your second quadrant. And when we see, this one is your tooth number 2-3. Okay, here is your 2-3. Now it says that most important principle in ensuring favorable prognosis, and here we are talking about your restorative principle. Now, shade matching, the answer will only be shade matching when we are talking about a patient having problem with respect to there being a filling there already. We don't have a filling right now. We are going to put a filling there, and then what will be more important for us is we remove the decay, we fill it up, we put a restorative material on the top, and we want it to be there as it is for long. We don't want it to get out of that place as soon as possible. We place it because patient has dry mouth, if you remember. Now, if the patient has dry mouth, there is a possibility that decay can still happen again. There can be secondary caries happening later on. So, our main goal is to obtain a marginal seal so that the filling sits there for a longer time. There is no secondary caries. The restoration should not break down or anything should happen. We don't want that to happen. So, that is the main answer. That should be the answer here. Definitely, we need to remove the caries, but nowadays we do not prefer or we do not focus on removing all the caries. For example, if I make a tooth here and there is your pulp here, so if the caries is just near this area, we do not try to remove it. We can leave it as it is. We can put a restoration on the top, and when we put a restoration on the top, we provide a proper seal. What happens is the bacteria cannot seep inside, and when the bacteria cannot seep inside and the bacteria which is inside there, they cannot get oxygen from outside, so they are not getting food from outside and they will not grow further. So we can still leave a little bit of caries in the bottom. So the answer will be marginal seal. Canine guidance, well, if you're talking about restoration, your prosthodontics, and we are talking about the biting and all, then we might talk about canine guidance. We are not talking about here. We are talking about restorative principle. Okay? Any doubts so far? Okay, so I'll go on to the next question now. That's your question number 4. So Nancy asked you about full mouth vital tooth bleaching as she has seen advertising which has convinced her that she needs to have it done. If Nancy opts to proceed with this, what is the most appropriate stage of treatment for her to have this done? Your time starts now for 30 seconds. Okay, stop. Please send your answers. After all treatment, okay. And the rest have said C. Any other answer? Trust me, I'm not going to judge anyone. You can give any answer that you like. Okay, so most of you are saying D or C. So let's have a look. So it says Nancy needs to get a bleaching done. She wants to get tooth bleaching for her whole mouth. Okay. Now, if she opts to proceed with this, what is the most appropriate stage of treatment for her to have it done? Now, whenever we get any treatment done, one thing you need to know is she has a lot of issues going on in her mouth. She has decays happening, she has plaque accumulated in her mouth. Okay, so we need to first always stabilize the condition. So what comes under stability? We have to control if there is any decay, any health issues. So any calculus is there, any caries is there, we will first work on that. And in that, we also put your temporary restoration. So these all will come under your stabilizing the condition first. Once you have stabilized the patient's condition, then you go ahead and you do any treatment. That will be either your prosto or your bleaching or your full restoration. Okay, so stabilizing, and then you do your permanent things for the patient. Now, what comes under permanent thing that we need to look at first is if the patient we have stabilized, we have put a temporary restoration. For example, we have put GIC in the patient's mouth. We can go ahead, do the treatment first, whatever is required, like bleaching if the patient is coming, patient is here for bleaching. So we do bleaching here and then we do your permanent filling. Now, what is the reason why we are doing permanent filling at the end is that there will be change in the color when we do bleaching in a patient. So after bleaching, the color of the mouth will change, the teeth color will change, and just to match that, then we will put your permanent filling. So because your permanent filling comes in different shades like A1, A2, A3, if the patient right now is, for example, A3 and the color changes to A2 or B1, we will put that filling in the patient's mouth so that the aesthetics look fine. So what should be the answer after that? The answer should be done after placement of your temporary restoration. Okay? And not after your definitive restoration. You will put your definitive restoration, that is your permanent restoration, after your bleaching. I hope you guys are not getting bored with question and answer, because these are the type of questions you'll see in the exam. So I'm just going to read it and then I'll put the 30 seconds timer, and just give me 1 second. I need to put my face here so that I feel I'm speaking something. Okay, so Nancy also mentions she is interested in having teeth 1 4 and 1 5 replaced with implants and crowns. Her friend had recent successful and aesthetically pleasing implants placed for her upper incisors. What is the most likely issue that may impact the ability to proceed with implant placement for Nancy? Your time starts now. Okay, I would like to read your answer. So, here the question asks us that she wants to get an implant done for the tooth 1 4 and 1 5 because her friend got implant done. Now, for the implant, we should know implant has 98% success rate. So, I don't believe there is going to be any issue for her if we are looking into her mouth, maybe from here. Okay. However, there are few things we need to understand. One is that we are replacing your upper teeth. So these teeth needs to be replaced. That is your upper teeth. We need to see few things. That is how the bone looks like. What is the bone quality? What is the bone quantity? Okay. We also look at your sinus, because your sinus is here. When the teeth are not there, what happens is your sinus starts going down, and that is called pneumatization. Pneumatization. Okay. Pneumatization means your sinus starts going down. It has space, so it will move down. So one thing that can happen. Now, this pneumatization can happen in a patient where there is lack of bone. So mostly the bone will be roughly 1 to 10 or 1 to 7 millimeter thick between your teeth and your sinus. However, when the tooth is not there, this gets reduced. So the quantity of the bone, that is an umbrella thing that I'm talking about, that will start getting reduced. And when that reduces, then we talk about your maxillary sinus thing. So what options do we have? One is your bone quantity may be inadequate because the tooth is not there. The bone starts resorbing from buccal and your lingual side. So horizontally, the bone start reducing in this space. That is what we will see. Option number B says mesiodistal space may be inadequate. Well, when the tooth is lost, that's less chance that this is going to happen because I can't see any drifting of the tooth. So whenever we lose a teeth, the teeth start drifting into that space. But I do not see the canine or the molar shifting into that space. So I can't say mesiodistal space may be inadequate. Now vertical space may be inadequate. What does that mean? Vertically, so vertically the space is reducing. Okay, we do understand that can happen. Your maxillary bone generally resorbs horizontally, and it resorbs from buccolingual direction, more from the buccal side, because your buccal bone is little thin, and that's also the reason why when we try to extract your tooth, we move buccally first. When we see the option D, it says maxillary sinus may extend to the premolar region. Well, that is definitely a possibility. But your first answer will be this, and your second answer will be this. So, in your ADC exam, there can be that all the question answers might be correct. But what will be the first is whatever is the broader term. Whatever is the first thing that will happen, the bone quantity will reduce, and then later on it can cause your maxillary sinus extension into the premolar region. So what is first and what comes next, that you should know. Then only you can solve the questions. Now, any doubts on this so far? Answer will be A. Okay, so I'll go ahead. So this is how we see the question in the exam. One question on the left and sub questions on the right, and there will be a timer on the top which will be ticking and causing a lot of trouble to your belly and to yourself. So we have to be very calm in the exam, and we need to understand what the question looks like. Now I want to ask you to rate the question from 1 to 5, 1 being easy and 5 being the most difficult, as in I'm telling you when we have done it together. So I want to know, how did you find this question? Okay, so you lot of you think that it is 3. Now trust me, if you are calm enough, it will seem to look like 2 or 1. So anxiety management is really important in the exam. You have to be chill. Whatever you have read, you have read. Whatever you know, you know. You can't reduce whatever you have learned. You cannot forget things. You will remember it. Don't worry about it. But thinking is important, that how you are thinking it. If you are thinking from the patient's perspective, what patient is here for, what do you have to do, if you make it in a proper structured way, you will be able to solve these questions out, and you do not have to worry about things. However, um, you need to focus, you need to make a plan so that you can solve things out, you can read it in a structured way. You know that okay, we are reading about perio, so we'll complete that first and then we'll go ahead. So that is what my strategy is, and that was my strategy when I was preparing for the exam. So what I provide is, I have made all the content module wise. So first module will be your periodontology and your TG and Odell. Now I have curated and put some TG lectures inside that, which are I'll say, like for example, antibiotics. So all antibiotics, whether it be your spreading odontogenic, your odontogenic chapter, or it be your chapter number 1, 2 and 3, wherever antibiotics is mentioned, that will be in your module 1. So I have combined them, made together a video, so it is easy to understand. So now you will know when you see this video of your TG, and you will understand that what is the situation where I'm going to put your you're going to give your antibiotics or not. So if for example we talk about in your implant peri-implantitis and perimucositis, in which condition will you give your antibiotics? If I just ask you this question, any idea? Anyone? Okay, yes. So we give antibiotics in your peri-implantitis, that will be for 7 days. But we do not give in mucositis. Mucositis is similar to gingivitis. So in that we will not give your antibiotic. And that's how all those things, what antibiotic to give, in which situation to give, in which not to give, that is all mentioned in my lectures in a proper structure way, so that you do not have to go here and there and look for information and get confused that is this information correct or not. So that's what my focus is. Some topics of TG will be in your module 1, then it will be in module 2 or module 3, based on the module heading. The periodontology, if you're talking about, most of those things will be there. However, there are additional topics as well. So we discuss in module 1 like this. Then your module 2 will be your more focus on your perio and your pedo and your ortho. Then your module 3 will be prosto. Your module 4 will be oral medicine, pathology, radiology, all those things. 5 is your oral surgery. I've put 6 as operative because operative and resto is more important, and it is better to have it in the end so that you have covered most of the part. You have covered your prosto because a lot of people have stress with prosto. You are cleared with that, and you go on to your operative with a fresh mind, and you remember a lot at the end. Then you have health promotion, special category patients. Like in special categories, you'll find patients like obesity, diabetes, your hypertension, and whatnot. So we'll discuss all those type of patients here, what treatment to do, what all. Like for example, we discussed about dry mouth in a patient who is hypertensive. So we discuss all these things which are linked to each other in your special category. We have infection control here and your professionalism. And then with your module 8, we start your past papers. We discuss about all the ADC samples. Like for example, we did a question right now. That's how we do your cases here. We revise everything again, and we try to fix whatever is missing here. So that's what I provide. That will be how the modules look like. So you will have perio videos. Please ignore the old here. I've put new one here now. So that's how your platform will look like. So whole platform you have, they have been categorized into module. We try to complete these things in 1 week. However, if you're not able to complete in 1 week, we can slow it down, put it for 2 weeks or 1.5 weeks. But we start your questions once you have completed your basics, once you have understood your basics. So all your information, all, so how it will be, it is like there will be notes on the screen, and I am also explaining things out the same way as I did your question. I do the concepts here. So the concepts will be here. We discuss about biological width, your staging grading. There's the questions definitely come from them, your BPE score or anything regarding your perio. After that, once we reach your your module 8, we start with your past papers, and trust me, you'll know the answers before we do all the questions. And this is how the video look like. And this is just an example. I thought it's good to show you a video so that you know what my videos look like, and a topic that everyone will like. You should understand it is removable partial denture. Partial means that some teeth will be there in the mouth while some will be missing at the point. Okay, so if we see, this is the most important classification called Kennedy's classification, where he has classified the partial areas, the empty areas, or the edentulous area, I must say, into 4 categories. So let's go ahead and understand that. So the class 1 is basically where you are bilaterally, you have missing teeth. Okay, I just got a message that the voice is not clear. 1 second, let me have a look. Yes, we try to do 1 week per module, but you can slow it down to 2 weeks. What we do is, so whenever we start, you take the course, I am going to call you when you start preparing, when you are in the week 1 module. I will discuss with you how you're feeling, how the things are going. If you have problem in completing in a week, we can slow it down. But I want most of you to be in the same in the same speed so that we can discuss the questions and it stays in your mind. Now, with your past papers, definitely I'll provide some recordings. I'll do the recordings of your past papers as well, so that you can listen to it anywhere, wherever you want. You can see your videos, that won't be an issue. But when we discuss about your ADC booklet that they have provided, that's what I believe that will be great if we can go together like this type of class. It all depends how everyone are feeling. If you want to do it one-on-one sessions like the one that we are doing, we can do that. Or if you want record it, I can record that as well and I can provide it as well. But I've made a video of your past paper as well. I can give it to you like that. It's all what matters to you, how you want to read. So my focus basically is it because everyone has a different way of learning. I am a person who will like to see pictures, photo, cartoons, videos and understand by that, while others they believe that reading material will be easier. So I will provide the reading material as well. All the research papers, all the books and all will be there on my platform. Plus, apart from that, there are videos. It is all dependent on you how you want to prepare. But definitely go through the videos because you'll see all the notes there. All the basic notes will be there. My voice will be there. I will be explaining you everything. It will not be mug up. And I have also added some videos from the YouTube as well, which are great to see. And by that, your concepts become clear. For example, if we are giving your inferior alveolar nerve block, if you see a video, you'll remember more where the patient, where you are putting your needle. Okay, and there will be some pictures like if we are talking about your perio, if we talk about, there will be pictures of how your bone loss looks like, how much of bone loss, what is stage 1, stage 2, like that. So all these will be there in the video. Now I'll try to play it. I hope the voice comes. If it is not, then if you want, I can send that clip to you on your WhatsApp. Will be there in the mouth, while some will be missing at the point. Okay, so if we see, this is the most important classification called Kennedy's classification, where he has classified the partial areas, the empty areas or the edentulous area, I must say, into 4 categories. So let's go ahead and understand that. So the class 1 is basically where you are bilaterally, you have missing teeth on both the sides, that means. Okay, so if any. Okay, so what I'll do is, you can message me hi. I'll share you this small clip. You can go through, you can listen to it so that you'll know what Kennedy's classification is. However, if we are talking about your Kennedy classification Applegate rule, that is addition to it. For that, obviously, you have to join the course, and by that, you'll get all the information. But I can definitely share this part to you. Now, so let's go on further, and I'll just tell you that's the last slide that I'm going to show you now. That is on what course that we are providing. So we have 2 courses. One is 5-month course, and the other is sorry, just checking the chat. Okay, so so there are 2 courses. One is a 5-month sprint course and the other is 10-month comprehensive course. Now, what does the sprint course or the 10-month comprehensive course cover is you'll get subject wide module, that what I've showed you like the recordings. There will be the ways how you can learn is obviously, there is notes there. I am speaking, so visual, auditory, and your reading material will also be there. So I'll give you research papers that I've used and the books as well. And I will include everything, whatever ADC has asked for. Then you get everything, as well as you can get all your past papers. We'll discuss all the live sessions of past papers if we do, or if you want, I can just record and give it to you as well on the platform. So this platform that I'm talking about, you cannot record. That's what I've logged. That's why I put a clip here. That was the reason of putting a clip there. But just telling you, you will get all the free mocks for preparing for the exam. You'll get my support. There is a way how you can send me doubts whenever you are reading or listening to anything on the platform itself. However, I will be available on the phone as well. You can chat with me. I've provided my phone number and I'll also give you phone number at the very end. By that, you can always contact me. And apart from that, you can also track your progress, what exactly, how many videos you have seen, and all those things. So, my focus will be to help you out as much as possible. Whatever happens, I am there for you. And even if you are stressed about, because I have done my part one paper, I know how it feels like when you're preparing for it. A lot of people actually leave their job and prepare for the exam, and even after that, it becomes difficult or challenging to clear the exam. I don't want you to go through all that stress. So, I will be there if you need any therapy in chit chatting with me or anything. Definitely go and interact with me. I don't mind. And these are all the links, and that's my phone number. You can always message me or call me on this phone number. But just want to let you know, I'm in Australia, so WhatsApp call will be great if you're calling from India or from Nepal or anywhere else, so that you don't pay for the call, or I can give you a call back. So that's all for today. You can click a picture of this one if you'd like, and I'll just want to ask if you have any doubts or anything that you want to discuss about. Yeah, sure. I can show you the modules. You can click a picture of that as well. Yeah. Anything else? Okay, so I am obviously I've done BDS, but after that I've done MBA in hospital and healthcare management. I've been living here for more than 3 years now, almost 4 years, and I've worked as a dental assistant, receptionist, and as well as a practice manager in Australia, in Bupa. And I've given my part one in 2023 March. I cleared in one go, and after that, I've given my part two as well. However, I am giving again for my part two. I have concepts cleared, because when you go into your part two preparation, you learn a lot of things which starts making sense. So whenever I was reading therapeutic guidelines when I was in part one, definitely the things were not 100% clear. But when I did my part two, it made sense. It actually fell into right place, that if this situation is there, if a patient has uncontrolled diabetes or a patient has diabetes, do we do the treatment, and what should be the treatment and what not should be the treatment? Do we give antibiotics or not? So all these fell into the correct place as soon as I did my part 2. And trust me, the reason why I've started this training is because when I was preparing for my part 1, before giving the exam, I wrote it in my diary that I want to teach because I can see what exactly the gap is in the market. People do not have the concepts for the exam, and for the exam actually you need to clear the concepts. Initially it used to be you remember, you memorize all the past papers and you give the exam, but nowadays the questions have become much more trickier. Nowadays they don't ask you what is the preferred type of suture material, they'll ask you the worst type of suture material. This was the question that came in March now. So these type of questions do come in the exam, and if you do not have the basics, you cannot do it. So let me go through the all the chat questions. See, there will be mocks subject wise, and there will be big mocks